Thank you and good morning, everybody. I'm honored actually to join this meeting today and to follow suit His Excellency the Minister of Health and take this opportunity to congratulate him on assuming that burden actually of handling the health file in Egypt, which is a big file. As has been elaborated by His Excellency the Minister of Health, Egypt has been taking the lead at the national level to address the disease burden when it comes to Hep C specifically, which is more predominant in Egypt. And my colleague here from the mission has prepared for me some notes, but I would ask his permission that I would digress because I've been privy to the details, some of the details related to that program and its evolution back in Egypt when I was working on issues related to intellectual property and health issues. And I would like to say that addressing this disease burden in Egypt was such a rare case, I may say, of multi-sectoral work that linked together the work on the health sector and as well in the industry sector, the pharmaceutical industry and the medical technologies industry, which was quite important also at the time. And the coordination and cooperation in that regard was quite fruitful and conducive to addressing the issue. And I may safely say that addressing Hep C in Egypt was some sort of a stepping stone for a larger program, the campaign to have the screening of 100 million Egyptians for predominant diseases in some sort of a mapping exercise of the disease burden in the country. And I may safely say as well that it was rarely unprecedented. And we appreciate the work that the coordination that we've had with WHO in this regard. In relation to the UN Group of Friends, I mean, Egypt on its own has been an advocate of addressing HCV at the multilateral level when it comes to WHO, adding it to other diseases of high prevalence and incidence like HIV and TB and others. And maybe also add the medications that relate to it to the essentials medicines list at WHO, and WHO may correct me if I'm wrong in this regard. But again, I would like to highlight the role of the pharmaceutical industry and the medical technologies industry in this regard, and how we can do the intermarriage between supporting the local industry to produce the medications that are needed. The national strategy has also been focusing, as is mentioned by His Excellency the Minister of Health, on the prevention aspect of it and the awareness raising, and then the discussions with the pharmaceutical companies to provide Egypt with the medications that are required for the implementation of the national strategy was quite a good example of cooperation between national industry, international pharmaceuticals, and the health sector in Egypt, and other aspects of this in terms of financing and addressing the whole sequel of steps that should have been taken in order to address this. So in this regard, and since we've had a success story that relates to addressing Hep C in Egypt, Egypt wanted also to expand on this experience and to share this experience and extend its hands to other countries, especially in the African continent, when there is an incidence, a high incidence of or prevalence of hepatitis in general, not necessarily Hep C. And I've been in a brotherly African country when the first teams from the Ministry of Health has been visiting some African countries to do the cooperation, to do the screening, the primary screening, the preliminary screening, in order to be able to address and respond to the needs of a number of countries in this regard. And in this connection and in extension of that line of cooperation, I'm glad here and honored also to declare that in cooperation with Ghana, Egypt is providing 3,000 doses of complete HCV treatment regimen to our brothers and sisters in Ghana, and we are happy to do that, and it is a sign of our support to African countries and our readiness also to be involved in international efforts to address hepatitis, HCV in general, the viral hepatitis, and to address the needs of other countries in this regard, either by sharing of experiences or providing actual medications and maybe diagnostic tools if that is available and possible in our regard. And we appreciate also the cooperation from other multilateral partners and also as a public-private partnership from other pharmaceuticals and companies that work in this domain. And along the same lines that has been mentioned by His Excellency the Minister of Health, we are very glad to be here at the launching of the Group of Friends and to lead the way for the first year, to share our experiences in this regard. And thank you again for the invitation, and good luck to everybody. Thank you.